Hi, my name is Abby Sturts. I'm a 7th semester nursing student at Lincoln University. Today's date is October 23rd, 2017, and the time is approximately 3 o'clock in the afternoon. So today I am going to perform an insulin injection on my patient. I am going to do insulin injection using an insulin pen and also drawing up insulin in the vials. So to begin, I have received orders from my physician to go ahead and administer 5 units of Novolog AC, or Novolog 5 units of Novolog sub-Q to my patient. So before I begin, I want to check and verify my patient's blood glucose levels that they actually need to have the insulin, which I have verified it and they do need it. So I've gathered up my supplies and I've gone in, identified my patient using 2 patient identifiers, told my patient what we would be doing. I provided my patient with privacy and I performed hand hygiene. So now I can go ahead and begin. To begin, I want to make sure I actually have insulin in my pen, which I do. So I'm going to go ahead and clean the top of the pen before I put my needle on. And before I can give the insulin to my patient, I need to do a prime the needle by giving a test dose of 2 units. So I'm going to go ahead, dial it up to 2, verify that with the nurse in the room.
2.
Okay. So I'm going to go ahead and give my test dose, which it did. So now I'm ready to go ahead and dial up to my 5 units. I've dialed up to 5, so I want to go ahead and verify that with the other nurse to make sure that it's actually 5.
5 units.
Okay. So now I'm ready to go ahead and give this to my patient. So I want to ask my patient where they have previously received their insulin or where they give their insulin at. So I'm going to go ahead and give their insulin right here. So first I want to squeeze up, go in at a 90-degree angle, push it in and hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And I've gone ahead and I would now want to go and document the type of insulin that I gave my patient, the amount, where I gave it at, and how my patient tolerated it. The blood glucose level should go ahead and they will already be in the system to know how much my patient received. So I would also perform hand hygiene at this point. So I've now received orders from my physician to go ahead and give my patient regular insulin mixed with NPH. So I have verified my physician's orders of 4 units of regular and 8 units of NPH. I have checked my patient's blood glucose level to make sure that they actually need it, and they do. So I'm going to go ahead, gather up my supplies, and now I'm ready. So I've gone into my patient's room, identified my patient using 2 patient identifiers. I have performed hand hygiene, provided my patient with privacy, and now I'm ready. So I want to also ask my patient where they have received insulin at, so that we are not continuously giving their insulin shots in the same location. So I want to go ahead, before I can draw up any of my insulin, I have to mix the NPH by rolling it about 10 to 18 times. Okay. So now I'm going to go ahead. I'm going to clean the tops of both of my insulins. Okay. So to begin, I'm going to draw up my 4 units of air. Verified that it's 4 units of air.
4 units.
Okay, so I've gone ahead and I've already cleaned the top of my regular. So I'm gonna go ahead and put the air in and draw up the 4 units. Okay. So at this point, I want to verify with my other nurse that I have 4 units.
4 units.
So I'm ready to go ahead and mix my MPH, which I do not inject air into this one. I've already cleaned the top. And I want to draw it up to 12. Okay. So next, I'm going to verify that I have drawn up just 12 units, or I have a total of 12 units.
Units.
Okay. So now I'm ready to go ahead, and I've already asked my patient where they have previously received their insulin at. So I'm going to go ahead and clean the area. I'm going to give it over here. Clean my area. So I'm going to go ahead, pinch up my area again, and go in directly at 90 degrees and give it. I do not have to hold with this one. So at this point, I want to document how well my patient tolerated it, how much insulin I actually gave, where I gave the insulin at, and the blood glucose levels once again are actually in there. So I'm going to also perform hand hygiene at this point, and I have demonstrated how to provide insulin to my patient.